Since 1924, the American Heart Association has been fighting heart disease and stroke and helping families and communities thrive. With 40 million volunteers and supporters, we've contributed more than $4.6 billion to life-saving research, including more than $20 million in Maryland this past year. With your help, we have saved lives, but our community still faces systemic problems that contribute to health disparities. Things such as a person's race, gender, income, and even zip code can impact their health. We believe everyone, no matter who they are, no matter where they live, work, or play, deserves to live their healthiest life. Our community initiatives in Baltimore and Greater Maryland are making a difference. They're helping to reduce barriers and increase equitable access to health and quality health care. We are working to impel leaders to adopt community-driven health equity plans that ensure progress towards addressing today's biggest issues. More than 1.5 million people living in Maryland have high blood pressure. This silent killer is often undetected and untreated, and it disproportionately impacts historically excluded communities in and around Baltimore. We meet people where they are to help improve blood pressure care, self-monitoring, and connect community organizations with the right tools and resources to join these efforts. Nearly 1 in every 3 Maryland families face food insecurity, not knowing where their next meal is coming from. In Baltimore, through our Simple Cooking with Heart Kitchen, we are teaching people skills to prepare meals for themselves and their families. And in collaboration with Maryland Food Bank Food Works initiative, we are expanding workforce development opportunities. We dedicate efforts and resources to increasing access to healthy foods, while reducing the consumption of unhealthy options like sugary drinks. We advance these changes via increased screening and intervention for nutrition insecurity, improved nutrition policy, such as healthier kids' meals in restaurants, increased participation in nutrition programs, such as school and after-school meals, and increased funding for local community-based entrepreneurs in food deserts. Tobacco continues to kill about 7,500 Maryland adults each year, and hundreds of thousands more suffer from tobacco-related diseases such as COPD or cancer. And nearly 25% of high school students statewide reported using an e-cigarette. Targeted marketing has disproportionately impacted communities of color. We work with communities in schools to prevent youth from starting, support individuals in quitting, and tirelessly advocate for public policies and funding that supports the most disproportionately impacted by the burden of tobacco and nicotine use. We are focused on closing the gender and ethnicity gaps in maternal mortality, research representation, and science and medicine careers. And when prevention efforts aren't enough, everyone deserves an immediate, life-saving response. Today, where someone lives, their gender or color of their skin can greatly diminish their chances of receiving CPR, emergency services, and the quality of health care needed to survive. We are working to end these disparities by ensuring places like schools and businesses require CPR training and emergency response plans that save lives, and by making sure that more people know how to administer hands-only CPR. We are working to make sure 911 operators can provide high-quality CPR instructions when someone calls for help, and hospitals are providing the highest quality of care. It's because of issues such as these that improving the health and well-being of Baltimore and Greater Maryland is essential for ourselves, for our loved ones, and for our communities. We have one mission: to be a relentless force for a world of longer, healthier lives. Together, we will continue to make a difference in Baltimore and Greater Maryland. Join us.